Welcome to Security in Minutes, a microlearning series from Safer Edge, where we introduce or explain a security topic in 2 minutes. Click subscribe to get a new microlearning in your feed each week. Infectious diseases are defined by the World Health Organization as pathogenic microorganisms such as bacteria, viruses, parasites, or fungi that can spread from one person to another. The COVID-19 virus is a well-known infectious disease because it became a pandemic. But there are many others that kill millions of people each year. Some other infectious diseases are tuberculosis, measles, influenza, Ebola, cholera, rabies, typhoid fever, and HIV/AIDS. Because infectious diseases spread swiftly, you may hear phrases like outbreak, epidemic, and pandemic used to describe their spread. An outbreak occurs when an infectious disease spreads faster than expected. An epidemic is when a significant number of people in a certain area become infected with a disease in a short period of time. A pandemic is when an epidemic spreads across a broad geographic area, including globally. Many infectious diseases can be avoided if best practices are followed. For example, good hygiene. Wash your hands frequently or use an alcohol-based hand sanitizer. Cover your mouth and nose when coughing or sneezing or wear a mask when ill. Shower or bathe regularly. Because many infections are transmitted by blood, wash and bandage all cuts and injuries thoroughly, and avoid picking at healing wounds. Food safety. Make sure your water is clean or has been filtered. Cook your food to a safe internal temperature and ensure that it is fresh or within the expiry date listed on the packaging. When eating out, try to choose cafes, restaurants, or vendors that have been inspected by a health inspector. Avoid sharing eating utensils with others. And if you must share a plate or bowl, eat from different sides. Vaccinations. Keep your vaccinations up to date as recommended by your local healthcare provider. Check to see what vaccinations are required or recommended before traveling to another location. Sexually transmitted diseases. Abstaining from sex is the only proven way to completely avoid sexually transmitted diseases. When having sex, make sure you and your partner have been tested for sexually transmitted diseases and that you are using a latex or polyurethane condom. In addition to these precautions, always know where you can get professional medical care. If you have travel or health insurance, see whether there is a phone number you may call if you become unwell. The UK's NHS Fit for Travel, the United States Centers for Disease Control, and the World Health Organization websites all provide up-to-date information on worldwide disease outbreaks and how to prevent their transmission. Safer Edge provides engaging, affordable, on-demand e-learning in multiple languages that can be customized to your organization. Send us an email to learn more.